Let's start this webinar on population engagement and decision making, the deliberation to policy gap. And welcome to all of you who are joining this morning. My name is Anya Suka. I'm the Director for Health Systems, Governance and Financing in the World Health Organization here in Geneva. And I'm here with the team, the WHO team, working on governance of health systems. And we are going to discuss over the next hour the handbook on social participation that was developed by the WHO together with the UHC 2030 Partnership for Health System, the Social Participation Technical Network associated to WHO, the Civil Society Engagement Mechanism of UHC 2030, the CSEM UHC 2030. And also, I want to acknowledge the contribution of many of you and others who contributed to this through the online consultation that was organized on the UHC 2030 website. The Handbook on Social Participation for Universal Health Coverage is one of the flagship products of WHO Department of Health System this year, and we really are thrilled to be able to present you one of the initial chapters today for in-depth discussion. Today's presentation, you will see, rests on an extensive review and analysis of primary and secondary data, looking actually at the science of participation, voice, and agency. You will hear more details on the methodology in a few minutes, how we took a thorough approach of both quantitative and qualitative research to look at this. But beyond this, beyond the methodological issues and the findings from the literature, we hope to hear from you, and hear you on the particular topic of decision making, and understanding better what your views and experiences are in terms of participatory processes in health, and how far the results are taken up in policy decisions. So whether really the central question of the linkage between participatory processes and decision making. So thank you very much for being here. Thank you for being part of this family on social participation for universal health coverage. And I'm looking forward to a vibrant discussion. But for now, let's start with the presentation by my colleague, Dr. Deepa Rajan, who is our expert on social participation in the governance department of the World Health Organization. Deepa.
Thank you, Agnès. And thank you all for taking the time to listen in, and we'll make an effort to really finish on time both the presentation and the session in and of itself, and especially the presentation, so that we have adequate time to hear from you. Just a little bit on how we will organize this session. So I will present some of the findings from our primary and secondary data analysis in about 20 minutes. 20 to 25 minutes, and then we'll do a question and answer session. Because of the large number of participants, we encourage all of you to put in your questions into the chat function of WebEx. We have my colleagues here who will be going through any questions that come up and synthesizing them, maybe putting some questions together that are similar to each other, so that you have the opportunity to have to put in your questions during the presentation itself. And at the end of my presentation, we will first focus on the questions that have come through the chat function. And if we have some time towards the end, then we'll do a more traditional oral question and answer interactive session, where we will then, of course, unmute those who raise their hand via the raise hand function of WebEx. I hope that's clear. So feel free to ask questions at any point in time during this presentation, and please use the chat function of WebEx for that. So let's get started on population engagement and decision making. And so one goal of social participation in health is clearly to influence health policy making, or at least that's the premise with which we are putting together this handbook. And so in this chapter, which is chapter 6 out of 8 chapters in the handbook, we attempt to address that question of how and by whom are decisions taken after participatory processes have taken place. And when I say participatory processes, I mean public consultations, population engagement mechanisms, deliberative processes, institutionalized mechanisms with fixed seats for civil society and lay participants, for example. So it's a very broad term that we're using here, and we made an attempt to really study all of the different types of mechanisms that do exist. So for those of you who are unable to listen to our general webinars introducing the handbook concept last week, I'm going to just very briefly mention what our approach is. And the main point here is that our target audience are clearly member state governments, they're policymakers. And this was a point of vibrant discussion within the Social Participation Technical Network, our external advisory body for this handbook, because the question was whether we should target policymakers only or also civil society. And for a number of reasons, we decided to target member state governments. One of the key reasons is that there is a huge gap in guidance for this group of decision makers who are struggling with participatory processes. We, in this handbook, we address various engagement modalities, as I just mentioned. We want to ultimately talk to populations and get the views of people. That can be either directly through direct mechanisms, it can be through the intermediaries of civil society, but it can also be through community engagement mechanisms. And this third bubble that you see on the slide through communities is especially relevant in the health sector, where disease-specific and life course-specific programs have over decades been working very closely with communities to improve program implementation and service delivery. So this mechanism is especially relevant for health, and it was the reason why we wanted to focus on that as well. We acknowledge that there is a huge overlap between these three mechanisms, that they are not mutually exclusive. They, in practice, intermingle with each other, and we have taken this into account in our research. And finally, for what? Why do we want to engage in participatory processes? And our overarching context is universal health coverage. This is the Handbook on Social Participation for Universal Health Coverage. And in that context, we are looking at decisions that are made around UHC-related topics, which are largely done at national level. So we're looking at national health policy processes, national planning processes, policy dialogue processes. This is not to say that that in some context, the subnational level will be relevant. In big federal entities such as India or Nigeria, of course, some of the competencies for these decisions are indeed at the state level. But in general, we're looking at national level processes or quasi-national processes, because that is where the UHC-related decisions are happening. We spent the last year generating evidence for this handbook, and this evidence generation and analysis process was accompanied by an external advisory group, the Social Participation Technical Network, and an internal group of our colleagues here at WHO who have been working on community participation for decades, mainly coming from the vertical programs. And then we did secondary analysis of the literature, and we collected primary data from 9 countries. These are the topics of the literature reviews, and today we'll be hearing about this particular topic. Especially on this topic of decision-making, we found that the literature had several gaps, which is why the primary data was very instrumental in giving us more information and a better understanding of this topic. These are the countries where we did case studies. 2 of them are already published and are available on our website. You can see we tried to have a good spread of countries across different regions, across country income groups, and also if you look at the topics, across the topics as well. These case studies were conducted partly by us, by WHO, and partly by the Social Participation Technical Network. And so then we come to the outline of the handbook, and today we'll be hearing about Chapter 5. So let's get into the actual topic of decision making, and I'm going to structure this according to 4 key findings. And firstly, I'm going to spend a bit of time talking about the actual problem statement. What is the actual issue between the link of participatory process and decision making? Then we will look at some of the factors that we found in our data that tips the balance towards more rather than less uptake of participatory process results into decisions. Then we will look at format and design aspects of the participatory process, which can increase the uptake of results by decision makers. And lastly, we'll spend just a very brief moment on capacity aspects to consider, which are pertinent for decision-making influence. And the reason why we'll spend less time on this is because we have a whole chapter on capacities, which will be presented to you in a subsequent webinar in, I believe, in about a month's time, on the 1st of April. So looking at the problem statement, first and foremost, there is a clear acknowledgement in the literature and also in our primary case study data that there is insufficient influence of public participation initiatives on decision making. And this is sometimes referred to in the literature as the deliberation to policy gap. So what that means is that the link between participation input and decision making is definitely not automatic. And even worse, very little documentation and guidance exists on that subject. So much of the literature focuses quite heavily on the process of participatory governance mechanisms and what happens when the process is over and how the input is used and analyzed is unclear. As an example, in one study, which looked at was a meta study that looked at almost 40 participatory processes, they found not a single one of those processes had a formal link between the actual participatory mechanism and an accountable decision-making authority. And a case in point is an example from Israel. In 2008, an experiment was conducted called the Health Parliament. It was unfortunately a one-off experiment. And in that Health Parliament, a number of lay citizens were convened to deliberate on the health benefit package design. And a lot of investment and in terms of resources and funds was put into the Health Parliament experiment. Experts were brought in, experts gave from different viewpoints, gave presentations to the health parliamentarians. There were several preparatory sessions that the health parliamentarians, these lay citizens, very much appreciated in subsequent interviews. And in the end, there was an official recommendation from the Health Parliament in terms of the questions they were asked. And this was then sent to the Ministry of Health, which then released an official Ministry of Health recommendation as well. However, the issue here was that the government body that was responsible for health benefit package decisions was actually not the Ministry of Health. It was another institution that took those official recommendations and shelved them. Unfortunately, they had not been involved in this process from the beginning, and there was definitely a perceived loss of decision-making power, and this experiment remained one-off. So this is, of course, perhaps a somewhat extreme example, but this is a case in point that sometimes a very well-designed process can happen, but in the end, nothing happens with the results because of the design of the process itself and the involvement of the right decision-making authorities. Interestingly, a finding from a review of the UK National Health Service patient and public involvement initiatives was that all stakeholders across the board, the public, patients, health professionals, government cadres, all felt and had the strong perception that the public does influence policy through these participatory processes. But when we looked at the documentation, there was A, very little documentation, and B, the documentation didn't show so much influence into policy. So there's a disconnect between what people think it can do and what it actually does. Our second point here is about policy uptake not always being the priority in participatory governance processes. And here we read and hear very often a value-driven argument about participation, that it is a value in and of itself, it's an intrinsic goal, and that is the reason to do the participatory process. And so the idea there is that people who are affected by a certain policy should have their say to lend process legitimacy to the policy and empower citizens along the way. But then you ask yourself, well, if policy uptake is not the principal objective, then what is? And in the literature, at least, there seems to be really very little consensus on that answer. There's a plethora of public participation effectiveness studies, but the effectiveness endpoint is defined very differently across the social science communities and is often linked to more process-related output. So it's often linked to, increased trust, for example, or increased willingness to collaborate with people who have opposing views, etc. So the endpoint is not always policy uptake. And part of this might be the fact that a participatory process is indeed a process. It's not a one single event, or it should not be a single one-off step, that a process involves several events and several opportunities to interact, and that each event may have its own objective and own methodology, which may not always be policy uptake. And indeed, some of the literature that we looked at, and in some of the case studies, we noted that there might be some risks, some inherent risks of putting too much pressure on deliberants, on those involved in participatory processes, to have policy uptake too soon. Because sometimes you do need some time to build trust, to build a mutual understanding for each other, and that some events may have those intermediate objectives, even if the overall objective of the whole process might be policy uptake. And so this might be what we are seeing then in the literature. So if we move on to factors which tip the balance towards more rather than less participation uptake into decisions, first and foremost, what we see is that a culture of participation clearly increases the likelihood of more policy uptake. And this might seem quite obvious, but when we look at beneath the surface to see what this actually means, it's about an institutional culture which embraces innovation, which is open to the change that comes about when listening to others and taking their views into account. And this is reflected in organizational senior management giving support to making policy changes based on participatory process inputs. And this sort of culture really doesn't happen overnight. And one thing that we clearly saw in our data that cultivates this sort of culture is just increased exposure to each other, increased opportunity to interact, increased opportunity to participate. And what we see is that attitudes indeed do seem to change to become more favorable to participation-based decisions, with more interaction between different stakeholders, even if this change comes about very, very slowly. And a caveat here is very much the fact that the initial period in some contexts can be very heated, very difficult, especially where there is a lot of mistrust and polarized views. So sometimes that the organizers of participatory spaces may have the feeling that the participatory process is going nowhere, that this is not really leading to anything useful. We saw this in Thailand 20 years ago when they started with their participatory processes. We saw it in Tunisia, which was in a very heated situation at the beginning, post-revolution. But after an initial period of anywhere between 6 months to a year, things do calm down, and people, by the inherent or by being forced to, in many cases, to interact with each other and sit down with each other, at the very least, there is much more of an understanding and respect for a different point of view. So what this really leads to is a recognition that we need long-term commitment for participation, because starting something that might be difficult at the beginning and quitting when it's heated and difficult might hinder any possibility for participation in the future with negative experience in mind. So one needs to be in it for the long haul when we're talking about participation. It takes time to build trust. It takes time to learn how to interact with each other. And it takes time to learn how to interact in a way that leads to feasible policy options. And in terms of policy and decision-making influence, the more we have these opportunities, the more that culture is fostered and the more that we can have more policy uptake. The second point here is on political will and decision-maker commitment. And this definitely increases the probability of integrating public voice into policies. But if we break this down, we're looking at decision-maker authority, capacity, and commitment. And in terms of authority, what we see in our data is that high-level political will and high-level policymaker commitment in terms of prime ministerial or ministerial commitment is important, but it's not enough. What we need is the mid-level government cadres who hold budgets, who actually hold the pen on policies, to also be on board and to also be convinced and also be supported in the how of participatory processes, because that is really where they struggle. In terms of decision-maker capacity, the feedback that we get from our member states and what we see in literature as well, that is that policymakers do struggle when it comes to steering, convening people, dealing with vested interests, managing diverging views, brokering consensus. These are not skills that are always a given in ministries of health or other government institutions. And this is where a lot of capacity building really needs to take place. And it also reflects in many ways the changing roles of ministries of health, moving away from more of a service delivery technical organization to more of an organization that steers and convenes. And finally, the commitment of decision makers to endorse and legitimize the participatory process rests quite a bit on how sound the process is. So it's a bit of a vicious or virtuous cycle, if you so will, in that decision makers are struggling to, in terms of format and design and soundness of process, but yet ensuring that it is sound leads to a perception of legitimacy of the process, which makes it easier for decision makers to commit to the results. So these are all different areas which we need to work on at the same time to improve the quality of these processes and ultimately to improve policy uptake. Next, I'll briefly mention the governance versus service delivery approach to participation, which this has elicited quite a bit of discussion within the social participation technical network. So I hope I'm able to explain this well to you. So here we distinguish two different approaches of decision makers to participation. One which has the primary objective of improving health service delivery, increasing, for example, facility utilization rates or augmenting service coverage, and one which has the principal purpose of ensuring good governance of the health sector. So while the two overlap largely, there is a slight difference because one focuses more on the listening and capturing people's voice to establish a responsive health system. But they overlap in the sense that the voice that is captured is largely going to be on, at least in health, on topics around health service availability, quality, etc. But the important point here is the mindset with which the participatory process is organized by government seems to make that tangible difference with regards to how far people's voice are taken up into health policy. So the service delivery approach tends to be more focused on bringing information to communities and people and incentivizing and convincing them to use curative and preventive health services. a quintessential example here being vaccination campaign, for example, where the point is to work with communities to increase coverage, but once that coverage is increased and vaccinations have been done, the objective for collaboration with communities is reached. And in terms of the governance approach, there is a very explicit interest in hearing from the people. So it's more of a two-way information flow rather than a one-way information flow. And as I said, the two approaches largely overlap, but the point here is that, and ideally we would want both in a system, but the governance approach tends to increase the probability of policy uptake into decisions, and that closer link between public voice and actual decision making. And we found this again and again in almost all of our case studies, in the National Rural Health Mission in India, for example, where if you've asked mission, we did a series of interviews with mission program staff and basically asked what is the objective of community participation, and we got answers such as raising awareness, getting access, ensuring that services are being delivered. It was the same in our case study in Madagascar, etc. And as a counterexample for the so-called governance approach, in the so-called États généraux de la bioéthique in France, so a large-scale public consultation on topics of bioethical relevance, the approach there was not to sensitize people to service delivery or provide services. The approach was, let's hear what people think about some of these controversial topics like assisted procreation and organ transplantation, et cetera, et cetera. And it was then taken up into the bioethics law, which was revised just recently in France this year. So I hope I've made that distinction a bit clear, and I'm happy to take questions on that later on. In the interest of time, I will try to go a bit quickly over the next few points on the slide. The institutionalized government-initiated and or supported spaces for participation seem to have higher policy uptake. In the literature, there's a distinction between invited versus invented spaces, as sometimes mentioned. Suffice it to say here that in invited spaces, there's much more of a direct link to policy uptake, so a higher probability of policy decisions being based on some of the public voice that was heard. But an important point is also that the invented spaces are just as important. We cannot just do with one without the other. Invented spaces are often extremely important to open the door for invited spaces. And the more there are invented spaces as well, the more there seems to be invited spaces. So they are mutually beneficial to each other. On legal frameworks, I'll skip this point because we have a whole webinar on this topic in 3 weeks' time, which I hope you'll all connect into. But the main message with legal frameworks is that you don't need them, participation. Sometimes you have the legal frameworks, but the participation doesn't happen. So, but what we do see is that where there is a momentum for participation and where there is especially a grassroots movement for participation, the legal framework can be extremely catalytic in institutionalizing it and bringing participation to the next level. So, and this is, we'll discuss this in more detail in 3 weeks' time. We have a whole chapter on this in the handbook as well. And finally, the policy and decision link is definitely easier if it aligns with decision maker views. And this again also might seem quite obvious, but there's a risk here as well, because if the views of the population and the views of decision makers align very closely, and there is a participatory process to validate that, there can be perceptions, and we've seen this in many countries, perceptions that this is just a tokenistic process and to rubber stamp a prefabricated decision. So this is a risk, and it's an important risk because participation rests on trust in the end. Without trust, participatory processes don't happen, and trust is something that's very difficult to build and very easy to lose. So here, my question is, and I don't have an answer to it, is that perhaps if the views are aligned so closely, is it worth a participatory process in the first place? And perhaps the effort to put together a participatory process should be focused more on those areas where there is a need for discussion and a need for debate and a need to find common ground because it doesn't exist already. And I'll skip over the last point, which I hope is somewhat obvious. The tokenistic approach obviously doesn't lead to public input and is risky because of the trust issue. On format in design, just to say very quickly, in the interest of time, there are format in design issues of the participatory processes that are really key in terms of influencing uptake of results by policymakers. And these have to do with representation and how far representativity is ensured. We have another webinar and a chapter on that topic. And one very key point is framing linked to policy. And this is very rare, actually. In many cases, what we saw in many of the participatory processes that we studied, the process is often initiated by a high-level buy-in to participation and the need for a participatory process to happen, but without a very refined policy question or a very refined objective. And without that, the link to policy is weak. And so much of the work that we are now trying to do with member states is to spend quite a bit of time actually around that framing and to really better understand why does one want to do participation and what is the expected outcome and how can we formulate that policy question in a way that the participatory input can be most useful for it to answer. Finally, I will just very briefly say on capacities, we have another webinar on this topic on April 1st, but just to say that in the whole handbook, we are framing the capacity issue in the following way. Because our target audience is policymakers, so we definitely are very interested in what are the necessary government capacities for participatory processes, and in this case, within the subtopic of decision-making influence. And on the side of civil society or people's capacities, we have looked at it from the lens of what can government actors do to support those capacities or build those capacities. And that's how we have framed it throughout the handbook. So in conclusion, I'd like to say that there is a deliberation to policy gap. And we should acknowledge that policy uptake may not be the intermediate objective and might rather be the ultimate goal in a larger process with other objectives in between. But political commitment, a culture of participation, a legal mandate, etc., are key ingredients or can be key ingredients to ensure policy uptake. And one of the most critical aspects is really the format and design of participatory processes. And we, in the handbook, we do spend quite a bit of time going into that in more detail. So thank you very much for listening. I apologize for taking a few minutes extra, but we hope we'll still have sufficient time to take your questions and comments. I'll hand over to my colleague Kira, who will be synthesizing some of the questions and throwing them back at me, so to speak.
Thank you very much, Deepa, for this presentation. And thank you very much again for listening in. We will now start the question and answer session. So please feel free to type in your question in the chat box. We have already received some of them. So maybe I would like to start with the technical ones in order to clarify. We had a question on whether the presentations will be shared afterwards and the recordings. That is question number 1. And then we also have one participant who would like to understand a little bit more who is actually on our webinar today. So please feel free to quickly introduce yourself when you are typing in your question so we can read out from which constituency and which perspective and where you're coming from. Thank you very much. And then there was another question on whether the drafts will be available online, the full drafts of the handbook. Over to you, Deepa.
Okay, so yes, of course we're happy to share the presentations, and for the recordings, I'm just looking at the team. We will be putting it up where?
We will be using it, so maybe I will just use this opportunity to also thank our collaborations with Health Systems Governance Collaborative, with Health Systems Global, the UHC Partnership, UHC 2030 and UHC 2030 Civil Society Consultation Engagement Mechanisms, the CSCM, and we will definitely upload them on the Health Systems Governance Collaborative website, and then of course will interlink with our other partners so that you can have them available as well online. Okay. Then maybe if I can take over, there was one question, I would say more on the understanding from Natalia Korachkova here. She's asking again to clarify what is the tokenistic approach.
Okay. Yes. So the question on who is on the webinar, we would have to go through the list of people on the webinar and verify their affiliation before we can answer that question fully, but we will do that analysis and put that up online. As for the draft outline, so we have the summaries of the drafts that are online for your review and input. This is on the UHC 2030 websites. The full drafts are being peer reviewed by various constituencies, including civil society. So if you are interested in reviewing or giving us an in-depth review, we definitely welcome that. And if you could email us your interest, we would then have a back and forth with you which chapter you would like to review and send that to you. So we basically aim to have all of the full drafts reviewed by the different constituencies, so civil society, academia, and member state governments, as well as our peers here at WHO and other UN agencies. So usually we have a number of reviewers, up to between 5 and 8 for each of the chapters. In terms of Natalia's question, in terms of tokenistic engagement. So in this chapter, we were looking specifically at decision-making, on how far decisions are taken based on public voice. And what we found there is that a tokenistic approach obviously does not really lead to public input influencing policies. And in one study from the Netherlands, actually, it showed the low uptick of patient organizations' input into a process of clinical guideline development. And they noted the lower value given to experiential knowledge vis-a-vis professional expert knowledge, and a subsequent dismissal of patients' input on decision-making committees to sort of tick the box on consultations. And this definitely reflects that dependent position of those who come with experiential knowledge to a consultation process vis-a-vis more professional expert knowledge, or the weight that you have coming in as a government cadre. And so this instrumentalization of patient or population input to legitimize decision that would have been made anyway, obviously means that there's a huge delink between the input and the actual decisions. And the main point here, though, is that the risks are really huge. Participatory governance mechanisms rely heavily on trust between the stakeholders, as well as trust in the process. So in this one Dutch example, there were loud voices from the Patient Association Committee to stop taking part, in fact, on these guideline development processes. And that is really the risk, is that you lose the trust of those who are giving input. And in order to ensure that decision-making uptake, there's a number of actions that one can take, and which we've addressed in this webinar. But basically, they rely on focusing heavily on a very sound format and design of the participatory process, looking at issues of representativity in more detail to ensure that the selection process is not only is transparent, but also is very clear as to who is coming to the table for which purpose and for which reason. And the format in design can also lend legitimacy and representativeness to the process as well. And then lastly is to design the process in a way that the content that is being discussed is linked to the decision maker authority that has jurisdiction over that content, so that there is that key link. And so those are just some of the things that one can do. And accompanying all of this is, of course, increased capacity building initiatives, both on the government side and also on the side of civil society and community groups. Government needs capacities to be built to first understand how participatory processes can even be useful, and to also understand how to do it, how to do participation in a way that is actually useful for their policymaking work.
Thank you very much, Deepa. We have another question coming in from Greg Burgess. It's related to accountability. He writes, participation is political, and in key areas, communities who are left behind have no legal status or are marginalized. How can the communities hold decision makers and donors more accountable?
Okay. Yes, thanks, Craig, for this question. Yes, completely agree. Participation at its core is political. And why is that? And it's really because at its core, it's about power relations. And this is an underlying recurrent theme throughout the whole handbook. So when we look at the chapter, for example, on enabling environment, a chapter on capacities, the premise is, and the starting point, and even on representation, the starting point is an unequal power relation. The starting point in a participatory space usually has government, health professionals, experts at an advantageous power position in relation to people, civil society, communities, and that is the reality of the situation. So the approach for anything, for capacity building, is to equalize, or attempt to equalize those power relations. The approach for the selection process and format and design is to create a level playing field. And this is what participation is all about. It's about creating that level playing field. But what that means inherently is that, or how it can perceive to be seen, is a loss of power on one side and gaining of power on the other side, which isn't really the case. What happens is that everyone gains and is more at a level playing field. And this is what a lot of the capacity building for government is all about, is to recognize that it's not necessarily a loss of power in the sense of being unable to make adequate policies. It's actually something that can be beneficial to the policy making. So in that sense, yes, it's political. And when it comes to marginalized communities, what we see is that even in the most sophisticated processes, such as the National Health Assembly in Thailand, or some of the public hearings and citizen jury processes, for example, in Tunisia, what we see is that marginalized communities still get left behind. Institutionalized processes sometimes have the tendency to reinforce existing societal hierarchies and power structures. And so one of the big recommendations that we are making in this handbook is that even with all of the various methodological approaches that a country may take to increase participation and participatory-based inputs, a special effort needs to be made to ask at every single point in time who is not at the table and how can we reach out to them. And this might mean more adapted methods, such as homogeneous focus groups amongst for example, in Tunisia, we did a focus group only with single women because they felt much more at ease to speak up amongst themselves, for example. It might mean that a process has to be taken to the communities, that it cannot be at the capital city in a fancy hotel, but that a separate process needs to happen to go to the communities, to go to their location in order to get their input. So that approach of always asking who is not at the table, how can we reach out to them in a specific and targeted way, needs to happen across the board at every stage of our participatory process, and even in the most sophisticated of processes we are seeing that marginalized communities, unfortunately, are left behind. In terms of accountability, I think having these mechanisms in place, government, these are government-led mechanisms that we are focusing on in the analysis for this book. But having these mechanisms in place gives you at least one added way to hold governments to account. It doesn't need to be the sole or unique way to do so. Obviously, other community-based accountability mechanisms can complement. But what we're saying is that even if those local accountability mechanisms are happening, they should be tapped into by national level governments in order to feed into national level policymaking. They should not stay only local, but that's the responsibility of national governments to put those mechanisms in place in an ideal case situation. I hope I've answered your question on that.
Thank you very much, Deepa. We are getting quite a lot of questions in there. I'm just taking one, which is again on a technical point of view, which we have from Franco on you're all invited to put in your comments to the survey, and the survey is currently accessible on the UHC 2030 website. We all encourage you to take part in this survey, where we basically ask you to provide your inputs to the draft chapters. The question was how long this consultation will be open. The consultation will be open until the 10th of April, so there is some more time, but please do. We very much would like to hear your input. And just to reiterate, the consultation is set up in English, but please feel free to respond in the language that you like, if it will be in French, in Spanish, in Portuguese, etc. Thank you very much. Then I have another question which comes in, and it very much touches about this tokenistic approach and how to reach good representation. We have this from Ramia Blanco, who is asking this. In the same line, there is the question from Thomas Schwartz, who is referring to the high-level meeting in New York, where we can see that there has been a deliberation to policy gap visible in the global WHO UNUT 2030-led process. We experienced that civil society there has been an input, but then he refers to a black box, no information about how input was processed, or a black hole on input just disappeared. So again, going into the lens of a tokenistic approach. And then I would just like to shoot another question towards you, and this is from Learn More Shikwebu, who also is saying the challenge is on access to informed decision, and as a young key populations with some of our country policies, it's hard to approach the government with our concerns. Over to you.
Okay, thanks, Kira. There's a lot in there. Let's see if I can. Okay, on tokenism and representation. From Ramia Blanco, is that the question? So if I understand the question correctly, it's about how to ensure that it's not tokenistic, that the process is not tokenistic, and what are the issues around representation that can help with that. Is that correct? Okay, so on representation, well, just to say, we will have a webinar on that in 2 weeks' time, which Kira and I will be doing, and I'll just give you very briefly sort of the approach that we're taking on that chapter, and then I invite you to listen in 2 weeks. Basically, in terms of representation, what we see is that we can, first of all, representativity and representativeness is, again, it's an issue of power relations, because those, as I said before, governments, experts, health professionals, they come into a participatory space, and they have a legitimacy based on their position, based on their expert knowledge, etc. Whereas civil society, people, communities, they come, and what is their legitimacy? So it's either the perception or the reality that they represent a large community or an important community, or sometimes it is their if it's a civil society organization, it's their representation around an issue. So a civil society organization might have a long-standing history of expertise in, let's say, women's health in some places. So those are often so representation and representativeness is about legitimacy, which it's also linked to power, because legitimacy is then your source of power and influence in these participatory spaces. So for representativeness in a government-led space where government is faced with the question of who to invite or motivate to come to these participatory spaces, there's two paths to follow, and both of them are equally important. One is, of course, the selection process, which needs to be adapted to the policy question and needs to be extremely transparent, and it needs to be clear why each person is at the table. What is the reason they're invited, i.e., what is their legitimacy, and what are they supposed to represent? Are they there because they represent a certain community? Are they there because they have a experience and a reputation on a certain issue? Are they there because we want their individual input and their individual views as so for example, a lay citizen, as a representative of something else, without them being a community representative or representative of that group per se, in terms of them feeding back and interacting with that group, but we're inviting them as an individual with an individual view, which we then see is representative of something, etc. So these are all things that need to be very well reflected on and made very clear to each of the participants so that each one has a legitimacy for being there. So that's the selection process, and we'll go into much more detail in the webinar in 2 weeks' time. The other aspect is format and design. So the format and design of the participatory process can lend legitimacy to the participants and lend legitimacy to representatives and give them that representativity or representativeness. And what we're talking about here is, for example, good preparation, adequate preparation, so that participants have the information they need, they have heard the different points of view, they have access, for example, in some cases to experts, they've had a chance to deliberate, they've had a chance to potentially glimpse the societal common good view of the topic, and potentially transcend their own individual interests. I'm not saying that they have to, but this is what the process can then lend legitimacy to the representatives and give legitimacy then to also the results, which then means the policy uptake is much more of a given. I hope I haven't complicated things too much. We will go into this in much more detail in 2 weeks' time. And we have a whole chapter on this. And some of these key points are also up on the civil society consultation on the UHC 2030 website. The next question on informed decisions and the difficulty to approach governments. Again, the difficulty of organizations to approach governments is, again, it's an issue of the power imbalance. And this is what the point of these participatory spaces, where governments and organizers of these spaces should always be striving to level the playing field. You'll never be completely equal, we acknowledge that, but the attempt to constantly make it more equal is what is important. And so these spaces give you that opportunity to discuss with policymakers and with governments. And these are the mechanisms that need to be much more in place and institutionalized in countries. And this is what we as WHO are encouraging and pushing member states to go towards in the quest to moving closer towards universal health coverage, because they are the underlying mechanisms that will sort of support and frame actions in health financing and service delivery as well.
Thank you very much, Deepa. I'm just looking at the time. It's 11 now here in Geneva. Maybe we take one more question for you, and then we try to finish up. Just on the technical questions that came in, the manual will be now in English. It will be available in English, and then we will think about some more dissemination strategies in order to make them maybe available in different languages as well. Then I would like to take maybe one more question from Braden Rogers, who is touching upon the difference between governance and service delivery. He says that they are often project-driven, expensive, and are difficult to scale. Would you consider the Health Governance Committee an example of governance approach? And should we be thinking about how to improve the capacity and representation of these structures? Health systems often have governance structures to get community input through community participation in health facility governance committee and boards at facility and subnational level. Participation may not always be representative. Would you consider this an example of the governance approach?
Okay, yes, thank you, Brian Rogers, is it, for this question. So we really made an attempt in our analysis to look at some of these mechanisms, these institutionalized mechanisms, such as the health facility committees, district level health committees, or national level coordination committees for health. And so, yes, so there's often issues of representation and representativity on these institutionalized mechanisms, but I think those can be worked on, and I think they can be analyzed, and we hope that we offer some solutions in the handbook. I think to start with, there's often there is an imbalance in numbers in terms of civil society actors vis-a-vis everyone else, especially government or experts. I'm not saying that there needs to be full parity. It really depends on the context and the situation, but at least it's something to think about based on the objectives of these committees and on what they're supposed to do. These committees are important. We need them in order to capture community voice to improve health services at local level. So their primary objective tends to be more service delivery, and the ones that we've worked with and the ones that we do know of. That's important and they're needed. But what I'm saying we need as well is that what happens in these committees and the decisions that are taken in these committees, the voices that are heard in these committees, should also be taken into consideration and go up to policy level, to the national level. So while they are very much needed at community level to provide responsive health services, that those voices, there need to be mechanisms in place to take those voices up in some way, shape, or form, also to national level, so that when policies are made around UHC related topics at national level, that they are taken into consideration. And at local level, I would argue that the focus is very much on, at least in practice, from what I've seen, is very much on service delivery. It's about improving services, improving service coverage, improving service utilization. And even at local level, there can be much more of a listening mode and a governance approach that integrated into these committees, because they exist already. And in fact, in our case study in India, where we looked at health facility committees, health committees, a lot of these mechanisms at local level, what we found is that, yes, they do increase community voice and mobilize communities in many ways. So they're very positive in many ways. And since they're there and the mechanisms are there, why not leverage them also for the governance aspect as well, also to listen and hear about some of the other problems that are linked to health, and then some of these issues around informal payments, corruption, some of these other issues then might come up once that safe space is created and trust is created through the listening process. So it won't be overnight and it won't be right away, but maybe over time. And part of that is, of course, increasing representation and improving representation of the committees.
Okay, thank you very much, Deepa, for your answers. We will be finishing up now. We apologize to the many more questions that we have received in the chat box. Due to time constraints, we will try to stick to our 1 hour, which is over now. But I would like to take the opportunity. We are having 3 more webinars coming out that look at specific topical chapters. The next one is on representation. It's on the 18th of March 2020 at 4 p.m. Central European Time. Then legal frameworks, 25th of March, 10 a.m. Central European Time. And then the last one on capacities for mutual beneficial engagement is on the 1st of April 2020 at 4 p.m. Central European Time. with this, I thank you very much for joining us today, and I very much look forward to welcoming you again to our next webinar in 2 weeks' time. Thank you very much.
Thank you.